Good morning once again. On my time check, 5 minutes have passed, and I hope you all got your coffee. So we are ready to kick off the program. Obviously, I have set protocol. When I used to work for the UN some years ago, I did a tour of duty in West Africa. And the first speaker had set the protocol. So I'll try my best. And so the subsequent speakers usually say, I beg to stand on existing protocol. So our special guest today, Mrs. Margaret Koskei. She's founder of the Chalan Foundation, and she's really our special guest and will be also later sharing some reflections about her journey with her organization to empower communities in education and health. You are welcome, Madame Koskei. The second guest, as I follow protocol, is Dr. Caroline Asin. She is the Deputy Director of Primary Health Care at the Ministry of Health, and she's here representing the Principal Secretary at the Ministry of Health. Welcome, Madam. Then we have Dr. Lois Rono, who is Advisor Health Services at the Office of the President. Welcome, Madam. From Village Reach, we have our board member, Dr. Nora Obudo. She's representing the whole board here, the whole Village Reach board. So welcome, Nora. Last but not least, is the chief host, our chief host today. That is none other than Dr. Ahmed Ogwell, CEO and President of Village Reach. Welcome, Ahmed. Village Reach, as you have seen, is 25 years old. The story of Village Reach started, I think, on an airplane. Dr. Gracia Machel and Mandela were invited to Seattle, Washington. And on the same flight was a tech entrepreneur from Cameroon called Blaise Sato. And they started discussing challenges in Africa, in Mozambique especially. And they, became friends, and that could have been the end of the story. But then some months later, in Cabo Delgado, there was a cyclone which hit. And Gracia Machel remembered the discussion on the flight and then reached out to Blaise. And they discussed how to help, get supplies to these remote areas that were hit by the cyclone. And so Blaise organized, being from the private sector, he initiated cooperation with a gas supplying company called Vida Gas. If they could take gas to these rural areas, then maybe they could help in taking supplies. So a partnership was built, and they started taking supplies, vaccines, medicines, partnering with the gas company, which also helped really in supporting the cold chain by ensuring that instead of using paraffin, they started using gas. So that's how Village Reach was born 25 years ago on a plane. And our first work was in Mozambique. And now we are, we have programs in more than 15 countries. So that's the short story. You will be hearing the long story from Ahmed. There will be videos, there will be speeches. So mine was ready to give you that first vivid story, but you'll get to hear more. So without further ado, I'm going to invite Ahmed, who is our president, to give the welcoming remarks. You know, Ahmed has been in this business for over 30 years in global health and African public health, and he's going to frame today's celebrations and the work ahead. Over to you, Ahmed.
Thank you very much, Director of Ceremonies. We need to remember the bits that make positions desirable. So a very good morning to everybody, and a very big thank you to you, Mrs. Margaret Koskei, our special guest, for making time and coming to join us this morning. You know, in public health, when you see many public health people coming together, usually there's a crisis. But today, as a public health organization, we are inviting you when there is no crisis. We are going to make merry as much as we can, because celebrating 25 years is not a mean achievement, as we will see the journey that we've gone through. So thank you very much, Mrs. Margaret Koskei, for joining us. Dr. Caroline Asen, on behalf of the leadership of the Ministry of Health, thank you very much for coming as well, and do pass our regards to the ministry. To our board, represented here by Dr. Nora, thank you very much for being here with us. From the Executive Office of the President, Advisor Dr. Rono, thank you also for being here. All heads of the various delegations that have joined us today, we are grateful for your partnership, collaboration, and presence to celebrate with us. Colleagues, ladies and gentlemen, it's really a privilege for me to be welcoming you during an occasion like this. And it is particularly a good occasion because we are holding it here in Nairobi. I happen to be a Kenyan in my previous life. I don't know which nationality I was. Everywhere I go, whenever I'm being introduced as a Kenyan, people refuse. They think I'm from West Africa. I need to speak with my father to check where the roots were. But really, it is special to be here in Nairobi at our Africa hub. And for me, this is not just a milestone. It's a moment of reflection, a moment of gratitude, and a moment of resolve. It's also a testament to just the resilience. 25 years ago, up in the air, people are talking, and 25 years later, we have an organization that is actually making a difference on the continent. So that is resilience, it is innovation, it is partnerships. It is also a moment of honor to the many pairs of hands and the many hearts that have shaped the journey of Village Reach. And many, many people have been involved in this process, as we'll see later on in the program.
Oh, hi, how are you?
It's also a moment when we recommit ourselves to the unfinished business that we still have in equity, in as far as global health is concerned, in as far as primary health care services are concerned. There is a lot that we still need to do to ensure that everyone has access to health care that allows them to thrive wherever they are. So it began, as Bernard has said, with that question up in the air: how do we make sure that healthcare reaches everyone, not just in times of crisis, but every day? And that question has resulted in a lot of answers. Every season, there are differences in our global health architecture, in our primary healthcare architecture. That question has continued to be answered by many in different ways. and it will continue to be answered by many because the job is not yet done. And despite all this effort and the huge progress that we have made across this continent, millions, some estimate it at about 600, millions of Africans still lack access to basic primary health care. And this will include well-trained personnel. This will include good health products. This will include proper health facilities. Millions across the continent still lack access to this type of service. Furthermore, our health systems are often strained by different pressures, whether it is climatic conditions, whether it is very frequent outbreaks that we see on the continent today, whether it is lack of appropriate budgets, whether it is stop work, stop, whatever orders that come from somewhere else. We are under pressure from very many different aspects, and healthcare suffers whenever any sector does not perform their duties correctly. So with all these challenges, it means that whatever tools that we are developing to advance healthcare on the continent, whatever knowledge we have acquired and accumulated to address the issues of health on the continent, we still need commitment, we still need focus so that we can be able to reach the goals of every person having access to the healthcare they need to allow them to thrive. At Village Reach, we believe that this type of transformation is not only possible, it is actually essential for us to achieve universal health coverage. Over the past 25 years, we've partnered particularly with governments, but also with the communities that we serve, with collaborators, with our funders, to ensure that we rethink and improve the way in which healthcare is delivered. We rethink and improve the way in which the hardest to reach are addressed with appropriate healthcare. We have, over time, improved supply chains for various health products, including vaccines, therapeutics, and diagnostics. We have strengthened community health workers with knowledge, with tools, by ensuring that they receive all the products that they need to serve their communities. We have improved data systems so that there's good visibility of what is happening at a community level. We have reached, to date, over 111 million people across the continent, and we want to grow that over the coming years with your collaboration, help, and partnership. But we are not celebrating numbers. We are actually celebrating people. Whenever we hear a number, behind that is a human being, and for us, our focus is that human being. That if we get that human being to feel cared for, to have access, then those numbers will be able to make sense. We are talking about children who have gotten vaccinated, some for the very first time. We are talking about mothers who have received healthcare in very safe hands. We are talking about healthcare workers who now have and have appropriate tools to be able to carry on with serving their communities. Ultimately, individuals whose lives have been saved, source of success. At Village Reach, we focus on working with governments and communities because we want to be practical and we want our work to be scalable, not projects, not pilots, but actually meaningful to the community today and will be meaningful to the communities tomorrow. For example, in Malawi, in Mozambique, in Tanzania, in the DRC, we have co-created logistic systems that not only track commodities, but ensure that those commodities are not missing. We do not want a situation where the health workers do not have the commodities that they need to serve the public, and therefore our logistics system that we've been co-creating with governments give them that visibility to ensure that there is good flow of the health products that they need. In the DRC, for example, we've delivered outbreak samples sometimes in very difficult situations, and you should see our staff crossing rivers by boat, walking long distances in roads that sometimes do not exist, on motorbikes, foot, to make sure that these products actually reach where they are supposed to reach. In Nigeria, we have worked with public health and private partners to digitize health logistics and therefore improve the visibility to data. Here in Kenya, we are working closely with both the national and the county governments and the relevant agencies, including KEMSA, to ensure that the community health promoters have all the health products and the supplies that they need. We are working across many countries on the continent. We are physically present in 7, but we are working in at least 20 to date. We look forward to working in more countries depending on the circumstances of need. What we have done does not require high tech. It does not require complex systems. Often the best innovation is simplicity. About innovation, people are thinking about really big things. Just very simple things like making sure that the youth are involved in determining the health within their communities. Sometimes it is as simple as making sure that health workers participate effectively in in the kind of training that they have. Sometimes it is as simple as making sure that when we are creating solutions, we do it with the communities. It doesn't take a lot to ask, what do you need? And how can it be able to be delivered to you? Many times we go as experts, and yet the real experts are out there in the communities. And this is the strength of Village Reach, that when we go out there and we innovate to simplicity so that our work can be able to be sustained within the communities that we work. We also believe that our strength is in partnerships. We cannot be able to do it on our own. Although we need to do it ourselves, we should not do it alone. We should always be able to bring together different partners, and our founders showed us exactly how it is done. A conversation between two, a catastrophe in Mozambique resulted in connecting rural problems with the good technology in as far as supply chain is concerned of that time. And look at what that has grown to be today. It is in that spirit of Ubuntu that has fueled the impact that we have made across the continent. It is in that spirit of Ubuntu that we are gathered here this morning to honor our governments for allowing us and trusting us to be partners, to honor the communities in which we work, so that we can be able to work together to achieve dignified, resilient health systems. It is in honor of our funders and our donors who have trusted us with their investments so that we can come up with sustainable commitments in innovation, in scaling up health initiatives. It is in honor of organizations like yourselves who are represented here today, working in collaboration with Village Reach, so that we can all be able to achieve better for the communities that we serve. But as we stand here today, we are at a difficult point in as health and the resourcing into the needs across the world have reduced significantly. The health needs have unfortunately increased also significantly. And in that flexion point, we need to find a model that works. We need to find a space where each and every one of us can be able to contribute and ensure that this flexion point does not become a point where things become worse, but it becomes a point where things actually become better. The next 5 years will define the next 25 years. Indeed, the next 5 months will define the next 5 years. We are focused as Village Reach on scaling up proven solutions so that we can be able to reach not just the 101 million, that 111 million we have reached so far, but we want to see ourselves reach at least 350 million by 2030. We are focused on deepening our presence across the African continent, using local teams, using local models, using solutions that are acceptable to the communities that we serve. We are focused on ensuring that we embed innovation, where innovation is really simplicity, embedding innovation in government systems, embedding innovation within our primary healthcare systems. We are focused on, most importantly, ensuring that the communities are at the center of each and every initiative that we are involved in. However, as we look into the future, we know that celebration often has a lot of nostalgia. We look back at all the good things that we've done. Fortunately or unfortunately, the future does not respect the past very much. And we need to start looking into the future, borrowing on the lessons of yesterday, but planning better for tomorrow, especially during these times of low resourcing. Let's look forward with purpose, and let's step up to scale up what works, and let's do it unapologetically, and let's do it boldly. One of our board members says that we need to have audacious optimism as we go forward, and I agree that if we don't have that during this flexion point, we cannot be able to achieve. So let's scale up what works, and let's do it boldly and without apologies. Let's share what we learn, and let's share it openly. You know, knowledge is only knowledge when it is shared. And if you don't share it, then it is not knowledge, however good it may be. So let's share what we have learned, and let's do it openly so that as many people as possible can be able to benefit across this continent of ours. Let's build solutions with the communities that we serve. We are not experts if we don't have communities, and if communities are not involved in what we are doing, then for sure that will remain a project. It will not be sustainable within that community. So let's build with the communities involved. And let's recommit to the vision that everyone, everywhere, deserves quality healthcare all the time. Everyone, everywhere, deserves quality healthcare all the time. 25 years has been a good journey, and I'm looking forward to the next 25 being even better, because now we have more knowledge, we have better tools, we have more enlightened communities, and we have more committed and partners. Let us work together to achieve universal health coverage in the shortest possible time until we are all safe. I thank you.
Thank you, Ahmed. You may wonder how Village Reach was able to reach 111 million people. You heard in Ahmed's speech, the key word is really partnership, it's collaboration, and our approach is specifically really working with governments to strengthen health systems, and through that reach these many numbers of people you have had, through ensuring that vaccines are available, medicines are where they are supposed to be. So the issue of partnerships, collaboration, synergy, that helps us to scale and achieve bigger impact than what we could achieve alone. So talking of partnerships, at this juncture, I would like to invite Dr. Caroline Asin, the Deputy Director of Primary Health Care at the Ministry of Health, who is representing the Principal Secretary. Caroline, you are welcome.
Thank you. Distinguished partners, colleagues, and friends, ladies and gentlemen, allow me to ride on the already established protocols Good morning. Good morning. I want to hear a stronger good morning in the spirit of partnerships. Good morning. So as introduced, I'm Dr. Caroline Asin. I normally prefer Dr. Asin. I work for the Ministry of Health at the Primary Healthcare Directorate. And I'm very privileged this morning to be standing here on behalf of our principal, Mary Modoni, who really wanted to be here today but could not make it. She has, however, sent all of you her warmest regards. And since I'm a messenger, please kindly allow me to read the speech that she had prepared to make in this meeting this morning. And so the speech starts now. It's a true honor to stand before you today to celebrate the 25th anniversary of Village Reach. This is not just a milestone for your organization, but it is also a moment of shared purpose for all of us working to build a healthier Africa. To Dr. Ahmed Ogwell, your team, and the Village Reach family, I extend my heartfelt gratitude. Your work in Kenya and across the continent is a testament to what is possible when vision, innovation, and unwavering partnership come together. I'm certain that we all have a shared commitment to the universal health coverage agenda. Here in Kenya, this vision of universal health coverage is more than just a policy objective, but it is also a promise that we have made to every citizen. It is enshrined in our Constitution, and it's a cornerstone of our national agenda, Vision 2030. We understand that true UHC is not just about financial protection, but it is also about ensuring that quality healthcare is physically available, it's accessible, and it's responsive to the needs of our people, and most especially to those who are hardest to reach. This is the very essence of a strong and responsive primary healthcare system, and this is where partnerships like ours are truly very essential. It is also highly imperative, therefore, that we need to work closely together collaboratively towards building the foundational blocks of a resilient system. The Ministry of Health is committed to building a resilient health system from the ground up, one that is equitable and people-powered. Our strategy is built on key pillars, and I am proud to say that Village Reach is a critical partner in this journey. First, on building the foundational blocks of UHC, our focus is on strengthening the last mile of healthcare delivery. Our partnership on the Community Health Units for Universal Healthcare, the CHU for UHC program, with Village Reach, the Luala Community Alliance, and others is a prime example. This initiative ensures that essential medicines and supplies are available at the community level, directly addressing the physical access component of our UHC goals and reducing the unacceptable rates of commodity stockouts. Secondly, we are committed to our community health workforce. Our community health promoters are indeed the heartbeat of our health system. We are therefore giving them the tools and training they need to be very effective. Through our work together, we have trained thousands of these frontline heroes in supply chain management. The integration of a commodity management module into the national HUS platform is a powerful step forward, making their work more efficient and data-driven. Thirdly, we are leveraging technology for a responsive health system. We are bringing the national e-health policy to life. And this is not just a theoretical concept, but it is about using tech to bridge the geographical gaps in healthcare. The Ministry of Health is working with Village Reach to transition the 719 COVID-19 hotline into a permanent multi-topic telehealth service. This demonstrates our commitment to transforming a one-off emergency line into a sustainable public utility that provides all Kenyans with easy access to health advice and referrals. And finally, we recognize our role in regional health security, for we all know that diseases do not respect borders. Our successful transition of the polio laboratory sample transport program is actually a testament to our commitment to building local capacity for a long-term sustainability. I am also very proud to share that the new genomics lab at the Kenya Medical Research Institute, KEMRI, which will serve as a regional hub for disease surveillance, will significantly strengthen our ability to detect and respond to cross-border threats. And now I would like to make a renewed call for our continued collaboration. And in this regard, I would like to emphasize that Village Reach has demonstrated that it is a partner that understands our government's priorities and that it designs solutions that are not only innovative, but also sustainable and integrated into our public systems. Your focus on building with communities and government and not around them is a model for effective development. And so as we look towards 2030, our work is far from over. I call on all partners in this room today, the private sector, communities, and donors, to join us in this journey. Let us continue to build a health system that is not only resilient to future shocks, but is also deeply responsive to the daily needs of every Kenyan. And with those few remarks, I hope they were few, I would like to say asanteni sana, and I want to wish the entire Village Reach team a happy 25th anniversary. God bless you all, and thank you very much.
Thank you, Dr. Asin. Oops, small accident there. No one was harmed. Yeah, indeed, yeah, partnerships, and you mentioned it already. We are in the era where we are asking for what we call more health for money. And so our partnerships with the Ministry of Health Kenya, where we are really looking at community health workers who do prevention, which is cheaper than cure. And so we really appreciate these partnerships, and thank you for the kind words and for that insight into how we are working with the government of Kenya. Right now, as they say a picture speaks louder than 1,000 words, right? So we are going to watch a short video about the founding of Village Reach, and you will see one of the founding members, really the initiator of Village Reach, I think Gracia Michelle in the video. So I hope the team is ready. Can we see the short video, please? Thank you.
We were struck by the floods, the 2000 floods, which were reported globally. We were struggling with how do we reach out to communities which had been stranded, had been separated. They didn't know how to communicate. We didn't know also where they were, how many, how to give them assistance. We struck then the connection with Blaise Jujasato, who was working for a global telecommunication company with the Craig McCaw. He comes in, he provides to us the technology of how to trace those communities. We travel with Jujasato to locate these communities. We could see what a very, very specific need of communities could be supported and taken to use global technology and solve a problem. That's when we decided then to consolidate and establishing Village Reach. From Seattle to Cabo Delgado, and from Cabo Delgado to every village there, they connected the Village Reach made the miracle. You have to have people who share the same vision. They build the connections, the hearts and the minds do the connections, and we can solve problems. We have learned the lessons of how do you shorten, for instance, you shorten the period where vaccines which are available in other parts of the world, they can reach the most remote village. You know how the heart works? The heart receives, it cleans, and it sends back.
All right, thank you. I think we should clap for our tech team. I think there's another one, another short one, so that we are
Village Reach
done.
has been Village Reach has been transforming healthcare delivery for the last 25 years. It's been a journey of resilience, innovation, and impact.
We started with a bold vision to close the gap between health services and those that need them most, always with a commitment to equity and always ensuring that no one is left behind.
From rebuilding the supply chain in Mozambique, we've grown into a Pan-African organization that strengthens farmer healthcare systems to be responsive for the hard-to-reach communities.
We have seen firsthand how partnering with governments and the private sector has improved health outcomes.
For the past 25 years, we've been working to break down the barriers that prevent healthcare from reaching the last mile.
The dedication and passion of our team have been the cornerstone of our success.
Our values of collaboration, innovation, and excellence inform the work we do to build resilient health systems.
Our telehealth work helps communities access health information on their mobile phones using technologies like WhatsApp, IVR, and hotlines.
Our efforts in building partnerships between the government and the private sector enable innovation in the health system for the Minister of Health.
Telling the stories of community health workers has been my passion. Through their dedication, I've come to see that they are the backbone of primary health care.
At Village Reach, we don't just manage numbers, but we build the foundation of sustainable impact.
Collaboration remains at the heart of our work. By building strong partnerships, we can even achieve greater impact together.
As part of our 2030 strategy, we are focused on reducing inequities in access to primary health care to reach 350 million people by the end of the decade.
Our goal is more than metrics. Behind every number is a story, a family, a future.
Together, let's continue to make a difference and transforming lives. The journey continues, and I'm proud to be part of it.
On behalf of Village Reach, thank you for your support. We look forward to the next 25 years of transforming healthcare together.
Okay, thank you so much, and thank you, the tech team.
So we are celebrating a very important milestone. I'm trying not to go up here because I need to see what's happening, but maybe it is easier. But please look at the slides, it is better. Really, we want to share with you a little bit of this transformational journey that we've had so that you can see just how dedicated, innovative, and committed we have been to try and make our contribution to improving the health of the communities that we serve. And if we can have the next slide. Are the slides working? Today seems to be one of those days. So if you'll bear with me, these slides today have decided to play a little bit of so our story began 25 years ago. And this was way back in the year 2000 when our founder, Blaise Juja Sato, Cameroonian American, started to support response in Mozambique after that very big cyclone in 2000, Cyclone Eline. At that time, there were a lot of difficulties in accessing the communities that had been affected by the flooding. I think we can go to the next slide. And part of the needs could not be achieved if communication, equipment, services were not in place. Now, during this time, the mission to find a way of reaching those communities then began. The first stop was logistics. How do we get a logistics management system that will be able to reach the communities that could not be reached easily? If you recall, during that time, it was only helicopters that were going to certain communities in Mozambique. If you recall, during that time, large parts of that country were cut off from the rest of the system, whether it was healthcare products, whether it was food, whether it was water. So a logistics management information system was extremely necessary. And as Village Reach, we launched the first management system to try and address that particular challenge of getting to the communities that had been cut off. This marked our commitment to leverage data and technology to try and build smarter supply chains for health services. It's also important to appreciate that during this time, the capacity of the government, of the people of Mozambique was relatively low. And so together with building the system, there was also capacity building of locals going on at the same time. So this was the first time that we put together a data management system. We put together a visibility map so that we could be able to see what product was where and how it could be able to reach those communities. And as Barnett had explained earlier, if we could get other products to the communities, why could we not get health products to the same communities? And utilizing some of that experience, capacity that the private sector had, and Juja Sato was actually a logistics expert working with a telecommunication company. We brought that into the health sector and managed to begin what will today be part of the strengths that Village Reach has. Next slide. Then, we went into a different part of technology, telehealth. And the first one was, and you'll forgive me, Chipatala Chapafoni. I think I said it right this time. I said it very wrongly yesterday in Lilongwe. So telehealth is an essential part of the healthcare system, especially when it is difficult to physically reach health facilities and healthcare workers. And in 2011, through innovation, we piloted our first telehealth program in Malawi, Chipatala Chapafoni, which translates to health center by phone. It is still running to date. And I dare say that we are very proud that it is the only telehealth program on the continent of Africa that started and never stopped. Many have started, unfortunately, including in Kenya, don't quote me, but many stopped, not Chipatala Chapafoni in Malawi. It is still running to date, and another unique aspect is that the government has fully taken it over. It is the one that is paying the health workers who are manning the phones. It is the one that is servicing the needs of that particular system. So we are very proud of this Chipatala Chapafoni, which is health center by phone. It became a game changer, and not only in Malawi, but particularly so in Malawi, because it showed how mobile technology could be able to bridge a very important gap in the healthcare system. When COVID came, it expanded, not just in Malawi, but elsewhere. Kenya had one, and I think we are working to try and bring it back online so they can be able to do what it needs to do. Mozambique has a running one, again, supported by Village Reach. Tanzania has just started one, Cote d'Ivoire the same. So getting the phone to do more than just communicate regularly between one person and the other was actually a very big milestone in the work that we as Village Reach have been doing to improve healthcare within the communities. Next slide. Then we went further and brought the capacity of drones into the health sector. In 2017, embraced what at that time was cutting-edge technology. It still is. Things are improving within the drone world, and I think the health sector needs to even more assess how we can be able to improve the use of drones within the health sector. This program revolutionized the last mile delivery, ensuring that the very hard to reach parts of a country can be able to get their supplies faster than even going across some of the cities. If you want to come from one side of Nairobi to the other during a good part of the traffic, it will take you longer than it takes for drones to drop healthcare products hundreds of kilometers away. So this brought flying to be an essential part of delivering medical products to the most remote and the hardest to reach communities. We are still continuing to expand knowledge and reduce the costs of drone technology so that it can be able to serve us within the health sector even more. We are very proud that we were the first to bring drones into the health space, and we continue to innovate with the drone companies to make them more efficient and more affordable. Next slide. In 2020, we marked 20 years of existence. And it's a significant milestone because as we celebrated the 20 years of operations, we could be able to proudly say that we had impacted over 46 million people across the continent. What had started as help to a community that had been cut off by floods ended up 20 years later being a program, an organization that was supporting over 46 million people across the continent of Africa. But we didn't stop there. Next slide. Continued to expand our operations. Today, we are in physically, as I said, in at least 7 countries, and we have footprints in another 13, so that that makes a total of about 20 countries that we are in on the continent of Africa. But in 2022, during the pandemic, our work expanded to go into the space of very crucial laboratory logistics and diagnostics. We launched the lab sample transport for polio eradication across 15 countries, demonstrating that our capacity to adapt beyond health products going to the health facilities, we could also facilitate through good logistics, samples coming from the facilities to central laboratories so that we could have diagnosis being done quickly and efficiently. We continue to run this program and we hope to expand it, especially because there are so many gaps in diagnostic capacity and there are so many outbreaks that continue to bedevil the continent of Africa. Next slide. Then we moved into the community. We have a program we call the Community Insights to Action, which we launched in 2023. This program ensures that our work is always guided by the needs of the people that we serve. We co-create with the communities. We don't go in and deliver a service even when we think we know the service that we are delivering is the right one. Those that you're delivering to must accept that service. And that is why, that is what this Community Insights to Action approach is all about. Co-creating with the communities, appreciating with them what their challenges may be, hearing what they feel are the right solutions, and then we contribute our modest knowledge to those that the communities already feel comfortable with. It embeds our responsive primary healthcare principle directly into each and every program that we deliver to those communities. This has ensured that our success rate have continued to increase, and it has also ensured that governments continue to trust us with a lot of the community-based work that needs to be done. Very recently, using this approach, we saw in the DRC, for example, reaching zero-dose children. It was not a competition, but as it was, different organizations were given the same work to do. And the areas where we went, there was always consistently an increase in access to zero-dose children, while other organizations did not achieve as much. We are very happy that the government of the DRC recognized Village Reach for that kind of approach. And for us, there is no innovation. The innovation is working with the community. Next slide. In 2024, our offices, by the way, are in this building somewhere on the other wing. So 2024, because most of our work is here on the continent of Africa, we felt we needed to have a hub that coordinates the work across all the countries. Being in 20 countries is not easy if you're trying to run it from many, many kilometers away. So we established this office here, and that provided us with a very good strategic location where we could be able to work with, support, and contribute to responsive primary healthcare across the continent of Africa. And we are looking forward to our base here being even more effective as we reach more and more communities across the continent. Some of the faces you see on that slide, you will see them across this room, and when you see them, please congratulate them. They have done a phenomenal job in making sure that our presence is not only being felt here in Nairobi, Kenya, but also across the African continent. Next slide. Then to community for UHC, I think, and this has been referred by Dr. from the ministry, it's a very important innovation for the continent of Africa. Often it is not discussed as much as it needs to be because many of the discussions happen in platforms out there, where for them community health workers, community health promoters are not a thing because they have access to health systems that don't rely on engagement with communities on a regular basis, using individuals that are trusted and individuals that have the right knowledge and the right tools. So for us, especially here in Kenya, ensuring that these community health workers can be able to receive the products that they need on a regular basis became our entry point into our partnership with the government. We have continued to build bridges, not just here, and this is just an example because we're in Nairobi, but we are building bridges across the continent. By the way, one thing that people don't know is that we also work in the United States of America. In the state of Washington, up there, at the corner, right up there, we are in rural communities there. And we are working with them to improve the way in which they access health. Health, for anyone who does not have access to it, is a challenge, whether you are in the developed or developing world. And as we work in those areas and as we work here on the continent, we see the similarities and the knowledge exchange that is possible, the lessons that we can be able to share. And we do this across all the work that we have on the continent and beyond. And as we continue to collaborate with governments and different healthcare institutions, different partners, we are learning as we also share what our experiences are, all to make sure that UHC is achieved through a community approach that is stable, sustainable, and effective. Next slide, please. In 2025, as we did our reflections, as we did our analysis, knowing that when we were 20 years old, we had reached 46.7 million across the continent, we also proudly showed that we had reached 111 million, not just ourselves, but also with our partners across the continent. That partnership, that collaboration of reaching 100 million people across the continent, of reaching 675,000 health workers by giving them capacity, whether it was knowledge or tools, by annually touching 14,000 facilities across the continent, was a thrill to see that our model was working, our partnerships were working, our collaborations were actually also working. And this remains a testament to the dedication of our teams, of our partners, of our collaborators, and particularly of the communities that we serve. Next slide. As we go into the future, and as we celebrate today, well, our celebrations are going to last the whole year. Forgive us, but we are happy with our. As we go into the future, our strategy is a vision. Our strategy is a vision to continue to support the Sustainable Development Goals. Our strategy will ultimately aim at achieving universal health coverage across the countries where we are. Our strategy is intentional so that we can contribute to the continent's indicators moving towards better, away from the perennial bad readings that we see. Ours has been a transformational journey, and we continue with our commitment of bringing health within reach for all those who need it, including you and me. You know, many times when we talk about communities, we are thinking about villages. But that's not true. You and me too need access to good health care. And that access can only be assured if we make every effort for the underreached to also have access. If we don't do that, then they can become the source of our unhealthy environment. We need to be a source of their healthy environment so that they too become a source of our healthy environment. So this journey over the past 25 years, one of growth, innovation, and very deep impact, we would like to continue it. And with all humility, we achieve because we've been allowed to achieve by the communities that we serve. We succeed because the communities have actually accepted to work with us. We are able to make progress because governments have accepted that we are their trusted advisors and collaborators. If we continue in this path, then the future we'll be even more energized, have even more opportunities, and we can be able to have even more impact than we've had to date. The journey of 25 years of Village Reach can be told in many words, but for me, only one word stands out in this whole journey, and it is partnership. If I were to use 2 words, I will call it trusted partnership. If I was to use 3 words, then I will say it is trusted partnership with communities. We can't be able to do it on our own. We must be able to do it with others so that we can have sustainable impact in our communities. Thank you very much.
So I'll tell you the secret of what Ahmed asked me, that the team, our technical team, this is the chance to redeem yourselves. Because Village Reach, we pride ourselves, as you heard, in technology, innovation, and digitalization. So please let our technology not let us down. So if the videos are ready, I think we should see both of them. And after that, then we will welcome our panel. But before, as they prepare, let me recognize all the partners who are here. If I miss your name, please tell me. I won't mention individuals, but I'll mention the partner organizations. As you heard, we really pride ourselves in partnership, collaboration, scale, and achieve impact. So we have Medic, we have Luara, we have Amref, we have Volante, we have InSupply, we have Shalon, Fresh Life, Finance Health Alliance, Path, KEMSA, Fright in Time, Johnson & Johnson, and the media. So thank you all really for showing up. And again, we look forward to greater partnerships to scale our innovations and then reach the 350 million people. Right now, we are going to see how to involve everyone. We're going to have a panel discussion. And obviously, after that, have the participants or the teams here get engaged, asking questions. And let me take the opportunity to invite Carla Blovelt, our Senior Director for Global Programs, who will guide the discussion, focusing on what we call responsive primary health care, really. And we have distinguished panelists in the room who include Dr. Lois Rono, Advisor Health Services, Office of the President. You're welcome to join the floor. Please give a round of applause. Then we have Dr. Tom Kariuki. Oh, here next to me. Dr. Kariuki is the CEO of Science for Africa Foundation. You see, it is missing here. Thanks for correcting. Welcome to the... Then we have Ms. Liz German. I hope I pronounce your name well. She's the CEO of Volante and advises leadership and management for organizations. And last but not least, Dr. Kenneth Ogendo. He's the Director of External Affairs in Luala Community. These are our partners in the community health work. So welcome, Kenneth. So let me hand over to Carla to take us through. Thanks, Carla.
Great. Thank you so much, Dr. Bennett. So now we have heard so far about the journey of Village Reach. We've heard amazing speeches from the government. We've seen our journey from Gracia Michel to why the staff are really excited for working at Village Reach. And now we're going to look broader. We're going to look at what does the future of responsive primary healthcare really look like. And I'm really excited to be with this panel of experts, and I'll give a little bit more background on each of them so you can hear just what amazing and unique experiences they bring to the table. So thank you so much, and we're really excited to have you. So first, I'm going to reintroduce Dr. Rono, just to give all of her amazing background. So Dr. Rono is an experienced healthcare leader with 10 plus years in medical science, health policy, and strategic planning. As Dr. Bennett said, she's currently serving as the health advisor in the President's Economic Transformation Secretariat. She also leads efforts to integrate healthcare priorities into national economic development strategies. She co-founded a regional medical supplies company that actually works across 5 different countries in East and Central Africa. She served as the executive member of the Shalom Foundation, which promotes life skills, and we'll hear more about that today. She also is a member of the Mama Doing Good, which is an initiative under the Office of the First Lady, where she contributes to national efforts in uplifting women and children through health and empowerment programs. Please rejoin me in welcoming Dr. Rono. Second, I would like to introduce again Dr. Thomas Kariuki. He is the Chief Executive Officer of the Science for Africa Foundation, and that is a nonprofit and Pan-African organization that supports and strengthens and promotes science and innovation in Africa. Dr. Kariuki previously served as the Director of Programs for the Alliance for Accelerating Excellence in the Science for Africa. He was the director of the Institute of Primate Research, National Museums of Kenya, which is a WHO collaborating center for tropical disease and human reproduction. Dr. Kariuki's research interests have spanned across immunology for neglected tropical diseases. He's been involved in many global efforts to develop vaccines, drugs, and diagnostics for poverty-related diseases. He's published widely on vaccines and diagnostic development for schistosomiasis, malaria, and co-infections, and policy issues on medical research. He has also received many, many awards. I'll just name one of them, and that is the Presidential Honor of the Order of Grand Warrior of Kenya for scientific leadership and public services. And he is also an honorary professor of research at the Liverpool School of Tropical Medicine. Welcome. Next is Ms. Liz Jarman. Ms. Liz Jarman is a mission-driven leader with over 30 years of experience in driving systemic change through partnerships with African governments. She's been based in Kenya for over 13 years, and she helped scale the community health worker support tenfold as the CEO of Living Goods, reaching 7 million people and securing $100 million in funding. She pioneered government co-financing and led Africa's largest CHW digital health initiative. Ms. Jarman now leads Volante, a strategic advisory and mentoring practice supporting social impact leaders, boards, and funders through leadership stretch points, times of growth, transition, and pressure. She brings candid, calm, and experienced support to help organizations accelerate impact and strengthen leadership across and beyond. Please join me in welcoming Ms. Jarman. Finally, I would like to introduce Mr. Kenneth, Mr. right now, we'll get to why he'll be doctor soon, but Mr. Kenneth Ogendo. So Ken is a public health specialist with over 15 years of experience leading policy, advocacy, and health systems, strengthening initiatives across public and private sectors. He's currently the Director of External Affairs at Luala Community Alliance, where he serves local, national, and global policy engagement, strategic partnerships, and also advocacy for community-led systems. Kenneth has led senior roles in the Ministry of Health, JICA, Living Goods, Metatronics, and D-Tree International, driving systems change and innovation in primary health care. He's a PMP certified professional and a PhD candidate for business and management with a research focus on financing community health workers in Africa. So please join me in welcoming Mr. Ogendo. So thank you so much. I feel so humbled and so honored to be able to be speaking to you today. And reading your bios is really, really impressive. I've been reading through them and thinking, wow, do I even deserve to be on the stage talking to you? So thank you so much for joining us today. We're going to start, we really, like I said, want to look at what is the future of responsive primary health care? Where do we go from here? We just talked a lot about the last 25 years, but where do we go from here? So first, we'll start within Kenya, and then we'll go broader. So we'll start with Dr. Luis Ronco. So Kenya has really taken some bold steps in partnerships for primary health care and for community health. You have supported the stipends of the community health promoters, as well as kitting them and building and strengthening their skills. So from your perspective, how do you see this helping Kenya reach universal health coverage? And what do you think the big next steps are to make sure that all of those things that have been gained will be sustained?
Good morning, everyone here, and thank you for the questions. Surely, Kenya, we are on the forefront in achieving UHC, and from the Office of the President, really, we have really put health at the core of the bottom-up economic transformation agenda in the Kenya Kwanza government. And for us to achieve UHC and for sustainability, we have developed pillars which we are really following through so that we achieve UHC. And we have 4 pillars. One is health commodity security, integrated health information management ecosystem, human resources for health, and health financing. Those 4 are so key in enabling us as a country achieve UHC. And for this to be sustainable, we have had laws that have been assented to in Parliament, and there are actually 5 laws. This is record history. There hasn't been any administration that has passed 5 laws on healthcare, and not just healthcare, ensuring that we have universal health coverage. We surely can attest to that this is not the first time we are putting a try to achieving UHC. We had done it 3 times, and therefore we know that for it to be sustainable, it has to be anchored in law. And that is why His Excellency the President took a bold step and bold leadership to make sure that this law, this is not just in policy document, but it is in laws enacted in our Parliament. That means that the healthcare no longer remains in offices, but it goes down to the people. The law belongs to the people, and this is taking healthcare to the people. So health sovereignty is back to the people, the community. And with that, one of the key things to ensure that healthcare is sustainable is to change and shift from curative perspective into preventive and promotive. For sure, we all know that it is cheaper to prevent a disease than to treat it. And with that, we came up with 4 paradigm shifts, really. That this is to transform our approach to healthcare from curative. And we do a lot of prevention, and this is where we bring in our community health promoters, being part of a human resource pillar. So another shift was to change and shift from a non-comprehensive vertical services to a comprehensive integrated services, so that it is not just a standalone, but there's integration, there's collaboration with partners and different aspects, and not just partners alone, but even within government, that it is an all-of-government approach. It's not only the Ministry of Health that is mandated to ensure that people are healthy. It is an integrated approach where we have seen that His Excellency, the President, bringing even the ICT to ensure that technology is enabling health. And we saw in one of the laws, it led to the development of or rebirth of a new digital health authority. This is to bring digitization to healthcare so that we are not only addressing the now, but we are also forecasting for the future. We are also planning, and with digitization, it has helped us also to not just have just plans or just off-head plans or what we think, but it's evidence-based. So that this data is enabling the government to make evidence-based decisions and to know, for example, in this particular village, what is the most, what is the critical areas of health to address? In case of an outbreak like cholera, for example, we are able to actually predict it even from the digital platform, which not only is with the Ministry of Health, but even His Excellency the President can access it and log in. I do also can access it and check what is the trend, what is the epidemiology in this particular village, in this particular region. And the other key thing that we have done is to move from a fragmented primary healthcare structures into PCNs. PCN, this is primary care networks. In our primary care networks, this is a strengthened service delivery model where we have level 1 care. Level 1 is where we have our community health promoters, and we have 107,000 community health promoters. These community health promoters each reaches to 10 households. Literally, each village has a health person. And that is why His Excellency the President decided it's no longer people going for health. It is health going to where the people are. And with this, we've been able to even curb and even been able to get diagnosis of people with diabetes who are not even aware. Hypertension, because these community health promoters are kitted, and we appreciate this partnership. We know Village Reach has also, in a big way, amongst other partners, supported us in this, in kitting our community health promoters, so that it's not just about visiting a home. It is taking healthcare to that home, and His Excellency coined it Afya Nyumbani. Afya Nyumbani means health in our homesteads. So we are beyond the village. We have gone to the household, to the homes, right? So and then we move to a looking at sustainable financing. How do we sustainably achieve this? So with this, no longer is community health promoters. Initially, actually, they were being called volunteers. And being a volunteer means you can do when you want, and you can when you don't want. So His Excellency decided that instead of just having it as a volunteer, let's not only kit them, let's give them a stipend, let's pay them. And this one for sustainability, it has actually it's being budgeted for even from the national government, so that it's not just depending on donors and partners like you, but the national government has taken its bold step to not only kit the community promoters, but also give them a stipend. And this brings sustainability for this. And so in our community health system, we have the community health promoters, and they go to the homestead. As I've told you, each community health promoter is mandated to visit a household at least 6 times in a month. And should there be a pregnant or expectant mother, the geriatric health, these are the old people or children under 5. She is mandated to at least go to that homestead twice a week. And this helps us in planning for this population, for this demographics. We are able to know. And then the community health, the 10 community health promoters have their supervisor called this is the community health assistants or community health officers. And these ones, they man 10 of them. So with our population of 55 million roughly now, each community health promoter having 100 households, and this community health, 10 of them being manned or being headed by a trained professional, community health assistant, or we'll call them community health officers, are able to oversee in our Kenyan aspect, we can say to the ward level. This is 1,000 households. And this is what we form our PCN, because with the referral, a proper integrated referral mechanism, the community health promoter will refer this patient or this person they find at the home to a dispensary. This is a level 2 facility. And should there be any issue at the dispensary level, they refer the patient to the health center. And with this, it forms a robust community unit called primary care networks, and we are able to reach to our people across, really, to reach to them in their villages, in their homestead. So we are really grateful for Kenya. That is what we are championing, that is what we are doing, and we have seen tremendous response. We have seen tremendous support in terms of even hypertensive cases that weren't even aware, some patients who weren't aware they were hypertensive. And that is what has brought us to, and in this we are really aiming to reduce the cost of curative, because when we get to address these cases early, it is cheaper for the government, it is better for the person, and it gives us better prognosis and better livelihoods. Thank you.
Thank you so much for that. So there's so much to learn from the Kenyan government for other governments. So one that I heard was making sure things go into law to make sure that it can be sustained in the future, that it's important to invest in the preventive services, because I actually heard at the Devolution conference that for every $1 you invest, you get a $16 return on investment for primary health care. And so that's an incredible gain. And also to make sure that the services are integrated and that really there is health in every home. So thank you so much for that. I think we'll go next to Ken. We'll stay within the community health worker space and within Kenya. And we'll talk about a little bit about partnerships. So as you heard, one of the key things that we really treasure is partnerships. And you've been part of this overall primary healthcare journey for a long time. And can you please tell us what are the partnerships and the types of partnerships that have been necessary to get to the stage that Kenya is at now? And what are the partnerships that are needed for the future?
Yeah, thank you, Carla. Good morning, everyone. I want to start from your CEO's words this morning, and you said we need to embrace Ubuntu. We are because you are. And I must say, Carla, that I am very excited to sit next to Liz German, who hired me in 2016 in Living Goods, and really exemplifying the power of partnerships. Then, as Living Goods, I was in government together with Ruth Ngeshu and others, and she saw that for us to move the needle in community health, supplies, digital health, then you need to move with the government. And the story is so long. Up to now, I'll tell you, Carla, you have, we ended up working with engineer Peter Kamonde, who is now with you. He was at the back end, I was on the front end, and Liz on the driving seat. And we pulled out ECHIS, and then it was a prototype. And you can see that even now, I'm in Luala Community Alliance, he is in Village Reach, and Liz is now somewhere else, and the conversation is going on, meaning that the dream is bigger than ourselves, and that indeed is the power of partnerships, that we need to look for a dream that goes beyond an organization's scope and mandate. And through CHU for UHC, Community Health Units for Universal Health Coverage, we have advanced the legislation agenda in this country. Previously, Carla, we had the Community Health Services Bill, and it morphed into the Primary Health Care Services Bill, or rather Primary Health Care Act. And Primary Health Care Act has actually compelled the government to pay community health workers. And so as a result of the catalytic functions of CHU for UHC, where partners such as AMREF, Financing Alliance for Health, Living Goods, Luala, NI Africa, and a host of other 26 organizations, we have been able to move the needle to the next level. So I want to appreciate that Partnerships is powerful. And we have told the story of CHU4UHC not only in Skol in London this year, we have told the story of power of partnerships in Geneva. And I think CHU4UHC, where Village Reach also sits, Ahmed, you realize that without being together, we cannot move so far. So I want to appreciate that we cannot move forward if we do not have partnerships. I want to talk about a few partnership models, and I will start with one that happens at the highest echelon, and this is the Donor Collaborative. And I want to recognize J&J in the house. We usually call him as the father of CHU4UHC because he brought on board J&J, brought on board Elmer Philanthropies, and now we are getting in Gates Foundation, Crown Philanthropies, and we have let me call it a mechanism which is dubbed the Donor Collaborative. And it is appearing to us that if donors do not collaborate at that level, then you cannot have tangible dividends at lower levels. And also that helps us to reduce duplication, and we're able to pull finances together and move the needle together. And again, I want to appreciate that partnership also cannot happen without the government in place. And that's why we have Dr. Maureen, who sits in as the CHU4UHC chair, together with Julius, who is on sabbatical. That's why I'm seated here. And together we're able to move the needle and advance community health and primary health in this country. Again, Carla, I also want to recognize that we cannot move forward without having G2G partnerships, government to government. And we are all aware about the 50-50 sharing and the matching fund, the conditional grant that has given birth to the financing of community health workers on a 50-50 basis. This came as a result of the national government sitting together with the county government. And so we are seeing a unique partnership between levels of government. And this is something that Africa needs to embrace. And while appreciating what we did in Isiolo and Kisumu, the co-financing between partners and government, we're also seeing the importance of government co-financing health, as we are seeing in Kenya. And we are hoping that this will move forward as we continue. Again, the other example I want to talk to us about is co-financing, co-implementation, co-design, co-creation with all the players across the field. You find if you have a new innovation, for example, ECHIS, if ECHIS was just partner-driven, we could not have scaled it. So you need to design with the user from the beginning to the end. And human-centered design is one area that we need to continue advancing partnerships as partners. And one more that I want to mention that is important for us to recognize in this room is partnering with communities. And we have structures that are giving us that opportunity. And as Luala Community Alliance, you have seen the power of social accountability being driven by community health committees. Because we are all in this room, but without having a community health worker, a community health committee member, the people who are at the last mile, in the spirit of Village Reach, at the household, they need to be involved so that they can ask for their rights, because our constitution says that we need to give the highest attainable standard of health. So I would like to say that partnering with communities is now more important than ever, and we need to embrace social accountability. And again, CHC is also going to help us even finance our health, because they will sit in the participatory assemblies and ask for more money to go to primary health care and community health. And then lastly, I want to say that it is important for us to partner with the political class. And I'm happy that J&J gave this story in the Devolution Conference, where CHU4UHC was able to write the manifestos of the two political parties and ensure that the payment of community health workers was put in the manifestos, and which, through their bottom-up economic transformation agenda, they were able to pay community health workers. So we need to move out of our comfort zones and start interacting with the Ministry of Finance. We need to break the silos and ensure that we can bring on board the members of county assemblies at the lower levels, from health committee, budget committee, and not just preach to the choir. We need to start moving out and partner with those friends that we have not partnered before. I would like to end there and say even cross-sector collaboration is important, all the line ministries, because again, we need to appreciate the social determinants of health and move the agenda forward. Let me stop there and back to you, Kala.
Great, thank you so much. Can we clap for him? Thank you so much for that. So basically, in a nutshell, you have said partnerships are powerful, right? And that means across the board, that means with the government, with the communities, with the donors, with all of the partners, and that we really need to break down all silos, get out of our comfort zone, and work together. Thank you so much for that. Now we're going to move over to innovation. So we're going to go beyond Kenya and across the continent. And I'm going to call on Ms. Jarman to let us know a little bit about what you see. You've helped with innovation across the board and helped scale it and work with governments and communities on building it. What do you see as the future of innovation or innovative practices? What is the next big thing that we should be looking for responsive primary health care?
Thanks, Carla, and so great to be here this morning. When I was thinking about this, you know, you think AI, and you think of all the new flashy sort of biotechnology and things like that. And then I was thinking, you know what, it's the basics. So whilst those will all be around, I'm sure, I think it's building on what's already out there. So the first area, I think, is just really how you utilize data. So using technology to support the work in primary healthcare at the community health level is so critical, but I don't think it's about new flashy apps and things like that. I think it's the data that is used at every level. That includes the community health worker themselves, how they are having that real-time data to make them more effective, more efficient, for helping them to focus in on what will make the biggest difference in their communities. Their supervisors getting the data in real time so that they know which community health workers need the most support, who's doing a great job, where there are gaps. And then ultimately the policymakers are being able to see trends and respond very quickly. And yes, dashboards are important. And of course, the politicians want to see the dashboards. You know, I'm sure you have to have data to give to His Excellency to talk about the great work he's invested in. Of course, donors need to see where their money is going. But you need real insights that can be used for action at every single level. And that's where the investment and the innovation needs to come. And I think for that, you need digital systems that are integrated. They're interoperable. They are government-owned platforms, but that community health workers and the facilities and the supply chains are all talking to each other. And whilst I really think ownership sits with the government, I think delivery can come from tech experts, and I think there's going to be a growth in expertise in this field of technology. And you know, somebody once said to me, the reason, and apologies if I get this wrong, but the reason that technology was invested first in tax systems was because that brings in the money. And health is seen as an expense. And so that often is seen as donor funded. And I think we've all heard today that actually it's not an expense, it's an investment in health. And therefore the systems need to be the best they can be and run by the best people under government ownership. But I think the real innovation in technology is actually that governance and that integration as well as the data side. And then finally, I think the last two I would say is, again, it's not a big innovation, but thinking about financing in a different way. You know, Ken did a great job of talking about way back when he and I started talking about how we work with government and how we work in partnerships and banned the word competition and thinking about how financing can be more sustainable almost 10 years ago. And I'm so proud to be part of that journey in Kenya, where we have now somebody from the President's office absolutely committing and owning to the investment that it takes to have community health as the foundation, the backbone of universal health coverage. But I think that does take creativity. It does take pooled financing and donor collectives. It does take government identifying what they will finance now and where their vision is for the future. And as you said as well, it is understanding all those players and talking to people like ministries of finance. But I would say without cracking the financing, then innovation is just temporary. It's just little, little projects that happen. I think the other area we've talked about is the human-centered area of the work that happens in primary health care and to be responsive. And often we talk about innovation around the tools, but not the people themselves. And I think the next wave of innovation should be thinking about the people that are working in these systems. Of course, we expect them all to be paid fairly. But how do they get that support, that strong supervision that helps drive their performance even better, and using tools to enable them to do that and for those supervisors to be optimum, for them to start having career progression because they can do e-learning and other aspects that even if they're in the village and they're a community health worker, they can progress if they are able, if they want to. And they've got decision support. AI will come in using all that data to really hone in, make them more effective and help them with their decision support. But also wellness programs as well. I have met many community health workers in many different countries, and they have a lot on their shoulders because they are the front line. And many of them have dipped in their own pocket to support their communities. They feel that pressure so much that they even do that. So I think we don't talk enough about community health workers and potential burnout. And I think there are innovations that can support all that. And finally, and I think Ken touched on this as well, is primary healthcare systems do need to be government-led. They are here in Kenya. They are now very much, the momentum is there elsewhere. People have looked to Kenya to match what they're doing, but they need to be community-owned. And I think that, to me, that mindset shift is an innovation. And I think really having communities shaping the priorities, yes, government owning delivery, that's what real resilience and responsiveness is. And communities have to have that agency. They have to have the data. They have to be the ones not just giving the data up, but receiving the data to then hold government to account to ensure those services continue.
Great, thank you so much. Excellent. So I'm hearing, one, the innovations are not necessarily the shiniest things. They could be the most basic, but really they're about making sure that the people are at the center, making sure that the community owns them, and that there's really good governance across the board, and that we're breaking down the silos, not just in the partnerships, but even in the systems and the information systems as well. Thank you so much. So now we're going to do a little bit of a shift, because part of responsive primary healthcare is not just preventive. It's also the ability to react when there are shocks to the system. And so Dr. Kariuki, you've been working for ages on vaccines and neglected tropical diseases. And what do you see as really is important for making sure that the systems can be resilient when there are shocks and stresses to the system?
Thank you, Clara, and thank you for the introduction. Sometimes I forget about my own introductions. And thank you, Ahmed, for the invitation. Good. I've been seeing you, a lot of youth, in recent times, since you became a villager. Which is great. So a little bit about ourselves. We are down the road, actually. Our offices, for all of you, anybody who has been looking for a visa to go to Australia, from our Australian embassy, but please do not come there looking for a visa. They moved out. They're in the north, and we 100% occupy that office. But I think our signage is very, very big, so I always tell people that you can see our signage at the, you can see it from the moon. It's very big signage, just so that we are not mistaken to be an embassy. I think it's what we do. So the Sound for Africa Foundation, we are founded on doing 4 things that really are priorities for us. 1, towards prioritization for science and innovation. Then how do we design them? Programs actually that can address science and innovation. 3, most people sometimes prefer to look at us as a source of money. Yes, yeah, we do have some money to give out, but that's a third area of our work. But then, of course, there is an aspect around oversight and how we manage programs across the continent. We are a Pan-African organization. We are public charity. We are an international organization, but we are hosted here in Kenya. When we say prioritization, I think I can mention a few things that are important, because everything you do upstream, from discovery sciences to transitional sciences, including clinical trials, means that you must have those products before you start thinking about how you are going to get them into communities. We are there for supporting people working in infectious diseases. Unfortunately, in Africa, we still have more than 25% of infectious disease burden here in Africa. Some of those you mentioned, Clara, around neglected tropical diseases, some of them have been around for thousands of years. In fact, when they discover the mummies and pharaohs in Egypt, they find out some of the pharaohs and Egypt actually were afflicted by schistosomiasis, for example. And so that's how old some of these diseases have been with us. So we are funding and supporting those. We are funding and supporting non-communicable diseases. We have a huge, huge burden now. Cancer, mental health for young people. On a continent full of young people, we have a crisis of mental health. We are also supporting science communication. We live now in a new era of, is it misinformation and disinformation and the geopolitics that brought a lot of, many challenges there. We are supporting, and I think I have a head of community and public engagement who would love to be here. And I think beyond this meeting, because we're here to see beyond this meeting what we're going to do. My good friend tells me that talk is easy, results are very hard to get, and people don't like accountability. So we want to move beyond this meeting to results and accountability moving forward, and our partnerships with you. So one of the other things I would say is, I think it's very good we are leveraging around how we look at models, and particularly for us, we're very interested to look at the next generation of scientists and what solutions they can come up with. Particularly because we want, some of us will be in this space for many, many years, but what does the next generation want to do actually? Much of that is going to be driven by artificial intelligence, like you say. And we have been working to apply that along the thematic areas that we are supporting. Climate, health is our big, big investment, like I mentioned. But now we have the connection, the connectedness between climate and health, and equity, and food security. I mean, the model traditionally where we were saying there's a bucket for health, there's a bucket for climate, there's a bucket for food, that no longer applies. I think everything must be interdisciplinary, and that is how we want, we are doing this. We have ambitions, and we have partnerships. We source funding internationally. We have 15 currently major philanthropic organizations. There are some governments here and there, but also we are working with governments across the continent. That bucket of money, we then give it to those priority areas. But most important thing is we have ambitions allowed. How can we train more than 20 million young people to do great things that they can do with all these areas that I've mentioned? And training them doesn't mean that we expose them to 2 weeks of training. We are talking about scientists and mentors who can actually generate, harness the potential of young people. So we have more than 100 institutions across the continent. We have a presence in 40 countries. I see a lot of intersection about what is happening with the village reach, because you have a presence in many of these areas, we have a presence in those areas. We are working with institutions and we are scientists. And one of the challenges I always challenge ourselves as a continent is, yes, great vaccines, since the greatest innovation of humanity I believe myself, not necessarily because I've been working in vaccination and diagnostics for many years. But I think it's because one of the challenges I see is the dependency on things moving, discoveries made outside the continent. So dependency, I think we were very exposed by the COVID about how this is so important for us to start thinking about how we use the intellectual abilities we have for scientists. We receive great ideas around how to develop vaccines, how to develop diagnostics, how to look at even very basic products across the continent. And I think it's why we exist, is to make sure that discovery sciences is being supported, clinical trials and clinical research is supported, implementation and policy and engagement with government is supported. So we are not funding just the discovery work, we are funding across the continuum of research and the research value. And the other thing I would say is, when we think about what happens in terms of the space that we would like to partner with you, 5 things to always remind ourselves. 1, it's about people. Everything is about people. Young career researchers, innovators, community leaders, health workforce. When you think about pandemics and epidemics, one of the things we saw clearly is that when you make an investment for 10 years consistently, and you keep those centers and institutions always warm, not cold, always warm even if there are no crises. That's what we did with COVID-19. We had money, we put out a very quick call for $3 million available. We gave to the same people who have been training for 10 years, because they are the ones actually who already were engaged with policymakers. And immediately they were recruited to go and advise governments in West Africa, in East Africa, in Central Africa. I'm very proud when I go to these places that we have been working with. And by the way, many of you would hear about Mali when there is a coup, right? Or you hear about Niger because there have been another coup. And you hear about another coup somewhere else. But I can tell you, there are gems of excellence in those places. Brilliant places. 10 years ago, I visited Mali, and we were giving a big grant to the university there in Bamako. There was not much there. The infrastructure funding that we gave to them, they developed a surveillance platform, a genomics platform, a sequencing, genomics there. Now, 10 years later, when COVID came, they were prepared for it. We did the same in Ethiopia, a bioinformatics platform they built there. When COVID came, they were ready. And government actually put a lot of money there for the space, and we give the money for the infrastructure inside, the equipment and everything. That is the approach we take when we look at this. A partnership of government, a partnership with us as a non-government organization that is very much driven by public charity, and our international funders and our international partners. So I think there is a lot here that is across all the things that we are doing, but I think my emphasis here is, let's think about where are we sourcing our great medical products, our diagnostics. Manufacturing is at the center of it, but there is a misplaced interpretation and the journey on how we get to manufacturing, because everybody thinks that you can wake up tomorrow and start a manufacturing. If you don't have the technical know-how, forget it. They won't happen. It's not like establishing a bakery where you can have a loaf of bread tomorrow. I think it's so difficult, but I think this is where we can have collaborations with government to think about what are the inputs you need before you get into manufacturing. There's a lot we can say about that, but I think that's just a little bit about what we do, what we can do, and where we can partner.
Great, thank you so much. So basically, I'm hearing from you, for resilient health systems to be possible, we really need to shine light on the science that's happening in the continent and making sure that we're preparing for the future within the continent, and also that we prioritize science and innovation. I'm also hearing across all 4 that we need to break down silos. Each has said it in a different way, right? And so for him, it was climate, health, equity, and food security. So those are different sectors that people think about, but really all of these come together, because for responsive primary health care, it's beyond health. It's across the board. It's overall well-being, right? So we're gonna ask them one more question and a sentence for that one question. But before we do that, I'd like the audience to see if you have just 1 or 2 questions that you want to ask this esteemed group of panelists that we have here today?
Question, comment? Okay, we have one here. Introduce yourself and your short question.
It's not a question, sort of. Good morning, everyone. I'm happy to be here and to see our great panel here. I'm Michael Ouma, the chairperson for Global Health Association of Kenya. And on partnership, beautiful, I hear comments on partnership. And for me, the aspect that I felt you didn't mention is on South-to-South cooperations. What is your view on that? Because it has been, I think for a long time, I think we are missing that point of South-to-South cooperation when it comes to partnership. What is your view on that? Thank you.
Any other question? Or comment? Quick one. All right. Anybody? Oh.
Yeah, thank you, Michael Ouma. I'll share my comments, and of course, my colleagues can also chime in. And the aspects on partnerships needs to become a global conversation. And I was actually going to talk about global coalitions. And we are, as Luala, Living Goods, and a few other organizations within the room are part of a coalition called Community Health Impact Coalition, CHIC. And it brings on board many partners who are looking towards the financing of community health globally by addressing systemic issues at World Bank levels, at global financing facility levels, looking at Gavi and other global entities. And the whole idea is to see how can we ensure that community health workers are professionalized, salaried, paid, and also given all the supplies that they need. So I find that the Global South, which we should not be looking at it that way, we need to start becoming more bold and look at other financing mechanisms around the continent and also globally. I would like to mention that we have foundations such as Kenya Commercial Bank, M-Pesa, and other innovative financing mechanisms that can be sourced within this part of the world. And as we do that, we also need to be seeing how can we leverage the global resources, such as now Gavi is showing a lot of interest in financing primary health care and community health. So I would say it's a nascent conversation, and we need to keep at it and see how can we be more bold to bring on board new sources of revenue towards primary health care and also towards community health. I would also like to say that other things that we need to think about, for example, we have this African funder called Strive and Grace Masiyiwa. And they are keen to finance the End Fund and also the Beginnings Fund. And now the question is, do we have the capacity and are we bold and creative enough to look for other like-minded persons within the continent to bring about catalytic funding towards the causes that we are fighting for? And so that would be my comment for now.
I mean, that's a great question. I think there are maybe some specific examples. I think we have in a space where that question is becoming more and more valid. Again, it's a little bit of addressing some historical problems and baggage that are still with us about how knowledge and data actually moves across the world. Is it just unidirectional from the north to the south? Or how does it go south-south, how does it go within the intra-African collaboration? So those are some of the things, particularly for us as a Pan-African organization, are very, very keen. Specifically, we did a survey on mental health, and we wanted to hear voices from the global south, a lot more than actually from the global north. And that's because some of the drivers and contexts and culture are actually very, very connected between the global south across, and with Africa itself. We get more than 10,000 responses to that. We have a great connection of climate and health that has come out of those surveys. The other thing I would emphasize is that the models that we have produced here, for example, one big program we have is called Developing Excellence in Leadership and Training in Africa, is now a model that are actually being applied in Southeast Asia. It's been so successful, and it's great to see something that has actually been birthed in Africa that is being adopted. And I'll give you another example also. There's a tool for good financial grant practice that we have developed over 10 years. It's actually now global, and part of most of the organizations that are actually using it for accountability is actually in the global south. So we need to have areas where we can say we have priorities with the rest of the world, and we can learn from each other. We can learn when we have mobility grants between us and India, which have been going on for many years. South Korea is not maybe, they are global south, but now they're economically more north in terms of the economy. But we all hear about how great they have done. There are so many things, and I was very happy to have a delegation of more than 10 leaders in South Korea with very black suits, because, and really a lot to share with us. Just for this aspect of manufacturing, for example, we all know how successful they are. We can learn from them a lot. One sector in South Korea, in pharmaceutical, generates 30 billion shillings per year. I'm looking at you as government, because one of the neglect we have in places like Kenya, I guess I can say boldly because I'm not paid by the government, so I can say anything I want to say. One of the neglect is the fact that we haven't actually made investment in science and innovation. We want to do things quick. We want to have a manufacturing next week. Yes, we don't actually been investing in people who can actually operate in a manufacturing. It's not just pack and fill. I'm not talking about pack and fill. I'm talking about manufacturing end to end. And we really don't have capabilities, but this is another angle for partnerships.
Great, thank you so much. Now, I know we're running low on time, so I'm going to ask everyone the same question, and we're going to look back internal again for this 25th anniversary. And I ask you to just keep your response short to a sentence or two. For us in the room here, and for those online and for those beyond at Village Reach, we've just gone through 25 years at Village Reach. What would you say for the next 5, 10, 25 years we should focus on that will have the most impact? What is the advice you would give to us?
Thank you. Okay, so my advice for Village Reach will be to lead in partnerships. Be a bridge, because you cannot do it alone. Connect, partner with like-minded institutions, organizations, so that you can do more together. So for your, so that also in your next 25 years, that you be bold enough to innovate and humble enough to listen, so that you may be able to reach to every village in Africa. And always put community at the center. That's for me, precise as you asked for.
Thank you so
much. 5 quick things, because I have one which I've already been discussing with Ahmed. We spent 3 days in Cape Town together, so on the backdrop of the Table Mountain. We do not like climbing mountains, so we talked a lot. One is, I think we need to really focus on science diplomacy in a very big way. I think we are not going to get out and tell about our own challenges if we don't address that. So that's one of the things that we have already started working, doing something with Ahmed on that aspect. The second area, I think, for me is a focus on building integrated health information systems, and that should be connected with the data aspect. And for us, data is to think about ownership and sovereignty of that data. So how we integrate without this aspect of ownerships, risks, fragmentation, all of those areas need to be an integrated approach. So that, I think, is something that we can all think together. The third area for me is consider how we do the scalable, adaptable models of tools. So those tools, I think with 25 years of experience for you, one of the priorities is to define, of course, how do you demonstrate that these models can be scaled to even bigger. I think you've already tested many of the scaling, and how they have been adopted across the various different contexts is critical. It's a big continent, and we need to reach everywhere, actually. And you can teach a lot of us and a lot of partners about how to do this scaling. The other aspect is climate and health integration, and I think I've made that emphasis on how we can't speak about this without thinking about the intersection between all these areas. So embedding climate services in primary healthcare, for example, so that the frontline services use climate data and the tools to protect vulnerable populations that can come out of that. And then the final thing I would say, I think one of the neglect area is social and behavioral sciences. And it's one of those things where we say epidemics and pandemics, they start, they finish with communities. And yet, when we say this, we need to address the various perspectives around this. We have given large grants to people working on pandemic sciences. We want them to look across many biological areas, but we also want to embed social sciences in all those consortia. And we are going to hold them account to that when we receive their reports. So let's do this. Let's look social sciences, and particularly also let's ensure that we are engaging and onboarding knowledge that also can maximize on the great indigenous knowledge that we have across the continent.
I'm going to be a bit controversial, and I am thinking 25 years out, but I think you should be building towards irrelevance. If Village Reach is still delivering the basics, then the system has failed. Your greatest impact will be helping governments and communities take full ownership across the continent and walking away when the job is truly done on the basics. Now, you might still exist, but you shouldn't be doing the basics. You should be looking at those scalable innovations, picking those out, getting them to market quickly. That really will continue to improve the effectiveness of how healthcare can be accessed in far more effective and efficient ways than we can even dream of right now. Thanks.
Thank you. I'd just like to say a few things, and really recognizing that Village Reach has a compelling mission and vision to bridge the health inequities we have across the world. The first thing I would want to advise you, as I also advise Luala and other players, we need to diversify our income stream, especially after the stop work order that happened this year. There is a huge shift in the financing landscape. We have got huge fiscal disruptions, and any organization that wants to move on to the next frontier, then you have to rethink and reimagine financing. And again, I want to also call upon us to also see how can we best optimize domestic financing. And then lastly, any organization that is not embracing artificial intelligence, optimizing AI, will be obsolete in the next few years. So I would call upon all of us to see how can we leverage AI to optimize human rights capacities, to optimize, for example, household visitations. How do we help a community health worker to go to the most vulnerable households, because they're not having all the time in the world. They have 2 hours a day in Kenya. How can they go to the households? And the only way is to leverage artificial intelligence as we move forward. And I wish you all the best, and congratulations for this.
Great. Thank you so much for all of your inputs, and they all really hit home very well. So thank you so much. I would like one last round of applause for the panelists for their amazing contributions and advice. Thank you. Thank you so much. Great job. Thank you so much. I'm the sustainability lead, so I love that. Thank you. Thank you so much. I stole the microphone. I stole the microphone.
All right, that was a lot of knowledge. I was trying to write down, and I wrote a lot of information, learning, and obviously looking forward to partnering with all of you and see how we really scale, get bigger impacts. I think one of the aspects mentioned, I think by Liz, was on, was Liz, one of the panelists, talked about not competing, because we tend to compete in awards and you know, doing proposals to get funding. But I think Village Reach, we have reached a point where we say the most important thing is impact. So how do you get impact? You really partner with people, share knowledge, share evidence, share approaches, and then be able to reach more people and have bigger impact. So that's why we really value partnerships so much at Village Reach. All right, now to our special guest, Madam Margaret Koskei. Let me invite you. Margaret Koskei is the founder of Chalan Foundation. So she will be sharing with us reflections of her work in community empowerment and education, and how she has strengthened health-promoting environments for women and children across Kenya. Madam Koskei, you are welcome.
Take this opportunity to greet all of you. Good morning. May I also ride on the protocols that have already been established. And I really want to start by thanking the Village Reach for inviting me as you celebrate your 25 years. I just want to say congratulations. When I saw the word village, I was really excited because that is where we do our work in the village. So I was happy that there's somebody else who is thinking about the village. So congratulations. Good morning, distinguished guests, partners, colleagues, and friends. It is truly an honor to stand before you today as we celebrate 25 years of Village Reach. On behalf of Chalan Foundation, I bring warm congratulations and heartfelt gratitude for the invitation to share in this milestone. Today's theme, Transforming Healthcare Together, beautifully captures not only Village Reach's journey, but also the spirit of partnership we are here to celebrate. I would also like to offer special recognition to our government partners, donors, and regional collaborators. Your commitment and presence today mean the world. 25 years is not just a measure of time. It is a measure of commitment, it is a measure of courage, and a measure of lives transformed. Today, we celebrate a story of persistence and innovation that has touched millions. Village Reach has shown us that health equity is not a dream, it is a right. Over the past quarter century, Village Reach's impact has grown exponentially. Their work now increases access to quality health care for approximately 43 million people across sub-Saharan Africa through improved supply chains, strengthened health workforce capacity, and enhanced data-driven decision-making. Independent sources report that over 46.6 million lives have been touched by innovations such as advanced supply chains and drone-supported deliveries to remote areas. Remarkably, under the leadership of Emily Bancroft, Village Reach expanded its scope from reaching 20 million to over 111 million people, scaling across countries and launching regional hubs, including one here in Kenya. These numbers are more than statistics. They represent families accessing life-saving vaccines, medicines, and health information, often for the very first time. For a quarter of a century, Village Reach has reached the last mile, ensuring that medicines, vaccines, and services find families who were once forgotten. You have worked alongside governments, strengthened systems, and reminded the world that no barrier is too high, no distance too far when dignity is at stake. This is your legacy, a movement that declares you matter, your life counts, your health is important. And let me share the story of Chalan Foundation. From its earliest days, Chalan Foundation has worked with underreached communities, supporting vulnerable children, children with disabilities, and widows. What began as a compassionate response soon grew into a broader vision to build stronger, healthier communities by addressing poverty, vulnerability, and access to knowledge and healthcare. At Chalan Foundation, we deliberately target day secondary schools, which are found in almost every village. And I would like to add that in Kenya, we have about 4,000 public day secondary schools with a student population of about 3.9 students across Kenya. I recall visiting one of these schools where we supported students with school fees. I was shocked to learn that more than 50% of the girls were pregnant. Actually, in this particular school, there were pregnant children from class 4 all the way to 4th form. And I asked the school whether they needed, the school actually told me that they needed a library. They needed classrooms. But I asked them, I asked the principal, do you actually need a classroom or a library, or do you need a maternity wing as a school? We incorporated teenage reproductive health into our life skills program, adapting WHO's life skills framework, and we launched many campaigns that now we have been running for the last 13 years to address the issues of girls' pregnancies in school. Alongside menstrual health and hygiene programs, this campaign has brought remarkable change. Yes, that same school that had children pregnant from all the way from class 4 to 4th form, if you go there right now, they have less than 2 pregnancies per year. Returning to the same school 5 years later, the difference was clear. You could hardly spot a pregnant girl. Equally, for those who had already become young mothers, we gave them a second chance by ensuring they were supported to return to school. And we have these students who had dropped out of school and became mothers, but through Chalan Foundation, we supported them, and they've been able to go back to school, completed their studies, many qualified to go to universities, and their lives have changed. When I look at Village Reach's 25-year journey, I cannot help but reflect on my own. Village Reach began with a bold vision to reach the last mile, to bring health to communities often left behind. I too know what it means to be reached. Our purpose has always been the same, to light hope and remind the vulnerable that their future is worth fighting for. Just as healthcare must reach the farthest corners, so too must education, so that dignity and opportunity go hand in hand. When I see Village Reach work, I see a mirror of that same heartbeat. Different parts, different focus areas, but the same truth. Transformation begins when someone says you matter, you are not forgotten. That is why this anniversary is not only a celebration of Village Reach, it is also a call to all of us to continue building systems that restore dignity and equity. If there is one lesson our journeys both teach, it is this: none of us can do this alone. The challenge of inequity are too vast for any single organization. It takes partnership, it takes individuals, communities, businesses, governments, and foundations standing together. Transformation is born when compassion meets collaboration. As we celebrate 25 years, I am inspired to imagine the next 25 years. What if every child in every village had access to both healthcare and education? What if every woman, no matter her circumstances, had the opportunity to build a sustainable livelihood? What if equity was not the exception, but the norm? This is the future we must build. Systems that are resilient, inclusive, and driven by the very communities they serve. And as Village Reach has shown, lasting transformation is not only about reaching communities, it is about ensuring country ownership and sustainable systems that thrive long after any one of us steps away. On behalf of Chalan Foundation, I extend my heartfelt congratulations to the entire Village Reach family on this remarkable Silver Jubilee. Your journey inspires, your partnerships empower, your vision gives us hope that together we can build a future where no one is left behind in accessing quality healthcare. To Village Reach, happy 25th anniversary. May the next 25 years be defined by even deeper impact, stronger partnerships, and healthier, more empowered communities. When we transform healthcare together, we do more than save life. We light hope, we build brighter futures. Thank you very much and congratulations.
All right. Thank you, Madam, for those wonderful remarks and for congratulating us and wishing us well. We also wish you well because we are all trying to serve humanity and improve the well-being and quality of life of children, women, men, and everyone. Thank you so much. So we have come to the close now. And as you can see, the arrangements and the balloons, there are goodies to come. But at this juncture, allow me to invite our Global Board member, Dr. Nora Obudo. She's going to give the closing remarks, and then she will also lead us. She will lead us into the final session that includes the goodies. We'll cut a cake. We'll have a group photo. So, Nora, over to you.
As you can see, I was running to the stage to just so that we can get to the cake. So I think we will be upstanding for just a bit so that we give each other a high five, and you have to get to 25. So 5. So each high five is 5. So you need to get 5 people. So 5, 10, 15, 20, 25. Excellent. Okay, we got to 25 a long time ago. These conversations. Let's get to the end of this. So we can be seated, please. Thank you. Awesome. So I believe we have some blood circulation moving. I am Dr. Nora Obudo. I'm a medical doctor, public health specialist, a champion for women's leadership, and of course, male allyship, so men don't feel left out on this. I'm a learner. I keep learning and learning and relearning, and I think that's the approach we should have all the time. I am very privileged to be a board member at Village Reach. I stand here on behalf of the whole board that's global, on behalf of our chair, our amazing chair, Sena Kwao, and the rest of the team that I can't mention, but we are a very, very proud board. It has been a board that is very different for me. I sit in a couple of boards as well. But this is a board that is keen on accountability, is keen on asking the hard questions. So Dr. Gwel, as you see him sitting here, we have asked him some many questions and seeing how we are moving forward. But it's also a board that I found very distinct because we always say that the board is there to steer the organization to meet its strategy. There's all the fundraising conversation, but this is a board that actually contributes and to the pool, to the financing pool, to the fundraising. And I think when you contribute, then you can call for accountability. Nothing is ever free. When it's free, you really don't care. But when you're giving that 500 shillings or that 1 million, you'll ask the questions and you'll want to see things happening right. And it's something I really love about this board. Another thing was to ensure that transition happens, and transition happens well as part of its processes. From Emily to Dr. Gwel here, it has been a smooth process. It was intentional to ensure that we are identifying the right people to move forward, but also ensuring that the transition is seamless, and we can see it here. So very excited to be sitting here again and standing here again to celebrate Village Reach and all its successes. So again, to Village Reach, congratulations on your Silver Jubilee. So as we conclude today's gathering, because we must conclude, I want us to pause and reflect on what this moment truly represents. This 25th anniversary is not just a milestone for Village Reach, it's a milestone for everyone who believes that healthcare must reach every person. It is a moment of gratitude, a moment of renewed resolve, and a moment of partnership, as Dr. Gendo also mentioned, in the different forms that we need to look at it at. So over the years, we've seen how bold ideas, strong partnerships, and resilient communities can drive lasting change. This morning, we've been reminded that transformation is possible when governments, funders, organizations, and communities unite with a shared vision. We've also been reminded that progress isn't measured only in numbers, but lives touched. Children vaccinated on time, mothers cared for safely, health workers equipped to serve, and communities with stronger systems that they can trust. On behalf of the Village Reach Board, I want to extend our heartfelt thanks to the government of Kenya as represented here. Thank you so much for your presentation. And the Ministry of Health for your leadership and partnership. Our funders and donors alike for your unwavering commitment and shared vision. Our partners and organizations represented here who co-create and challenge us to do better. Our staff and team members across Africa who carry forward this mission with courage and dedication every day, despite the challenges that we know are inherent and are present right now. And you, our friends and colleagues, certainly gathered here for standing with us on this journey. As we look to 2030 and beyond, we know the task ahead is urgent. We must build health systems that are responsive, resilient, equitable, and people-powered. The next 25 years will require us to scale what works, deepen country ownership, and keep communities at the heart of every solution. And we also talked about maybe we should be relevant at that time. Because then we'd be really looking at what's really needed, what's the innovation that we're bringing up. We believe that with the right partnerships and a commitment to innovation, we can achieve health equity for all. So as we leave today, let's carry forward the spirit of this celebration. Let's recommit to the unfinished work of health equity. Let's continue to transform healthcare together. And let's ensure that every mother, every child, every community has the healthcare they need to thrive. And we're not leaving out the man here. I know there's always this thing, the mother, the child, the man equally important. Thank you for being here. Thank you for being part of this vision. The journey continues, and it continues with all of us, again, together. So thank you so much for being present here. And I think at this point, we need to get a sugar rush. For those who are working on NCDs, I wonder, maybe we should have been having some vegetable or quinoa cake, but we are allowed to have some sugar running in our systems. And I'm really, really excited to be having this process and this cake cutting going on. And I would like to, should I invite Carla over to support? Shall I? Oh, he's going to call like, fine.
Okay, yeah. So we are going to invite a few people to help us cut the cake. Oh yeah, if the podium could be taken away. Thank you, people. The very well-built people. So we'll invite a few people to help us with the cutting the cake. Obviously, our special guest, Madam Koskei, Ahmed, the government representatives, definitely. All of you three, if you can join in. The rest you will eat, don't worry. And we also have, actually, in this room, the longest serving staff member here with us, has clocked almost 10 years. And then we have the oldest staff member, and that's myself, in the whole organization. So we decided the longest serving and the oldest, we should also be there. So, all right. So how do we... But the oldest will keep doing MCs. Okay, so how do we organize this? How do we... Can this table be moved to the middle, or will it break? Where are the guys with muscle? Can it move? I hope we don't break things. Carefully. Slowly, slowly, slowly. So we have some space. Yeah, that's enough. Thank you, thank you. All right, so I don't know whether there's a song like congratulations or something. The knife, where is the knife? I don't know how to light these things. Where are the experts? You see? Happy birthday to you. Happy birthday, dear Village Reach. Happy birthday to you. Okay. How old are you now?
Congratulations. I have a message for you. God has sent me to you. I have a message for you. God has sent me to you. Listen, them say, them tell you say you can never be the one. But God say, make I tell you say now you him choose in 1 month, in 1 week. You will sing a new song in 2 days, a lesser than you will hear. Congratulations, you're in the glory of God. Congratulations, He has done it for you, and you will come back with a new song to sing. God is good. Yes, you will come again with a new song of praise. God is good. Oh, congratulations. them say that I can never be all that I see. I've seen that God is greater than that. Who can battle with the Lord? Nobody. Who can change his mind around me? Through many years, in many ways, I have seen his faithfulness ever and ever. Yeah. Congratulations, I have seen the glory of God. Congratulations, he has done it for me. And I have come back with a new song to sing. My God is good. Yes, I will come again with a new song of praise. My God is good.
Time for jubilation. Congratulations. No more tribulation.
So,
I bring you good news where you cannot refuse. Go on. I told you with Christ that you can never lose. Well gone. Woman, I beg you, give me your attention. Very, very soon you will share your testimony. One by one you will tell your testimony. Bigger than money, we say sweeter than money.
So the cake is going to be placed there, and breakfast continues. But we want to have a group photo. We want to have a group picture. Yeah. Okay. So our panelists, please come forward, and our special guests for the group photo. I know you are enjoying cake, and people don't want to leave cake. Yeah. So others will stand behind, right? Yeah. So the panelists and the chief guest. Yeah. I think you stand in front and then others at the back. Liz, you can lead them. You haven't got cake yet. No, I think the cake. No, I'm just saying. Come. The cake can be eaten later. We have the whole cake there, so before you leave, have your share. But let's have our panelists. And you, of course. Ken. Okay. Yeah. And
We need a balance.
I think you can extend this one.
All right, you are all ready? This is your photo camera. Are you all ready? I want to see beautiful smiles. All right, in 3, 2, 1, I'm going to say 2025, sorry, 25. In 3, 2, 1, 25. 25. I need power and energy. In 3, 2, 1, 25. 25. One more time, 25. 25. Very nice. One last one. I want us to put a 2 and a 5. I can't put a 2 here. Yes. A 2 and a 5. Very nice. So we say 20. Very nice. Let's try again in 3, 2, 1, 25. 25. One more time in 3, 2, 1, 25. 25. One last time, 25. 25. Very nice. Very nice. Okay. Lovely.
So thank you, everyone. You've been amazing, amazing team partnerships. There is still breakfast, networking, exchanging cards, and then I think departure at your own pleasure. Thank you very much. Clap for yourselves, by the way. All of you, hands for yourselves. Thank you, thank you.